Hey class, how's everybody doing today? Mr. Bermudez here, and today we'll be talking about the lifestyle choices of pregnancy. Okay class, so today's topic basically is going to cover, analyzing the relationship of an individual's lifestyle while they are pregnant and the increase of fetal alcohol syndrome, sudden infant death, low birth weight, and Down syndrome. Let's get into it. So I'm sure that we all know that drinking, smoking, and just generally doing other drugs will affect your pregnancy in a very bad way. It's super important to make sure that you are completely sober during the pregnancy and maintain a good nutritional diet and participate in some light physical exercise to keep you and your baby healthy for the rest of your pregnancy. So just a couple good ways to stay healthy during pregnancy is to make sure that you're eating vegetables, low saturated foods. Your calcium intake is a must. It's very important. Proper prenatal care. Make sure to talk to a healthcare provider as much as possible, and make sure to get exercise. That's super important. Cannot stress that enough. So next what we're going to do is we're going to watch YouTube video to further elaborate on why being healthy while pregnant is so important. Let's get into it. By a show of hands, can anybody tell me just one way to stay healthy during pregnancy? So now we are going to discuss fetal alcohol syndrome and the causes and effects from it. What fetal alcohol syndrome is when a child is exposed to alcohol while they are in the womb. Some developmental issues that may occur to your child after they are born is delayed development, low birth weight, and possibly a learning disability. A way to prevent fetal alcohol syndrome is to simply not drink alcohol while you're pregnant. You have a child in your stomach. Please do not drink. It's just not right. All right, class. So on deck, we have sudden infant death syndrome. Let's break it down. All right, class. So sudden infant death is pretty self-explanatory from the name that it was given. It's when the baby is sleeping and it doesn't detect low oxygen levels or has a buildup of carbon dioxide in the blood. Even though sudden infant death has dropped a lot, unfortunately still 2,500 infants die from sudden infant death per year. Sudden infant death is the third leading cause of infant mortality. All right, so now I'm going to play a YouTube video that further explains more about sudden infant death syndrome. All right, so next up we will be discussing about low birth weight. Low birth weight is when a baby is born weighing less than about 5 pounds, 8 ounces. Premature birth, which is 37 weeks of pregnancy, is the most common cause of low birth weight. Like I was explaining in the beginning of class today, it's really important to talk to a healthcare provider before having a child and to make sure what you can do to help reduce your risk of having a baby with low birth weight. The two most common medical risk factors of having a child with low birth weight is having premature labor and also chronic health conditions. So for our final topic of discussion, we will be discussing Down syndrome. Just a simple breakdown of what Down syndrome is. It's a genetic disorder caused when abnormal cell division results in extra genetic material from chromosome 21. Just a couple effects from Down syndrome. It's a distinct facial appearance, intellectual disability, developmental delays, and may be associated with thyroid disease. So for the final video I'm going to present today is a family who has a son named Ryan who was born with Down syndrome. Now the point of me showing this video today is to show that even though a child is born with Down syndrome, they can still achieve massive goals. So please have respect when watching this video. Please pay attention and enjoy. Now, how wholesome was that video? Ryan is going to have a blast in college. Like I was explaining in the beginning of the lesson, exercise is very important in the lifestyle of pregnancy. So for today's activity, we're going to do some pregnancy exercises that will keep you and the baby healthy. So I'm going to ask everybody just to move the desk to the side, not too far, but just give yourselves a little bit of space. All right, so our first workout is 15 squats. Ready? On my count, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Well done. All right, class, so our next exercise is going to be a 10-second wall sit. Ready? On my count, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. So for our third exercise, we're going to jog in place for 20 seconds. On my count, ready, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Well done. All right, class, so to wrap it up, we're just going to do one more exercise. And this exercise is just going to be basic lunges, left to right. So we're going to do that 10 times on my count. Ready, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job, class. All right, class. So another thing to remember is... Yo. 99, 100. Oh. Hey, class. Is it 5 o'clock already? Wow, I'm really starting to lose track of time. This whole coronavirus thing. That's so dumb. Yes, so Ryan gonna be lit at Clemson. Wow. Wow, Clemson. Are you joking?